Welcome to ASHA's webinar on the why, what, and how of interprofessional collaboration. I'm Ellen Fagan, Director of Continuing Education at the ASHA National Office. In just a few seconds, Loretta Nunez will introduce our presenters and tell you why we planned this webinar. Before you start listening to this webinar, you need to make sure you've downloaded and printed a copy of the handout entitled Core Competency Statements for Interprofessional Collaborative Practice. If you do not have that handout, would you please pause your webinar and access a copy of that from our website? You'll need to have that later on in the webinar when we do an interactive part. There are also other handouts available to you. These include the presenter information and a copy of the slides in a handout form if you'd like to have those. If you want a copy of these handouts before starting the webinar, please pause the webinar right here and access those handouts now. So let's begin. Here's Loretta Nunez to get us started.
Hello, and welcome to this webinar, Challenge 2015 to 2025, the why, what, and how of interprofessional collaboration. I'm Loretta Nunez, ASHA's Director of Academic Affairs and Research Education. I lead ASHA's strategic objective to advance interprofessional education and interprofessional collaborative practice, also known as IPE and IPP. Several authors contributed to this presentation who are part of ASHA's internal strategic objective team on IPE and IPP. 4 of us are presenting today. All of the presenters are employees of ASHA. None of the presenters received compensation for presenting this webinar. Deborah Dixon is ASHA's Director of School Services. Ellen Fagan is Director of Continuing Education. Lemmy McNeely is Chief Staff Officer for Speech-Language Pathology. And, of course, I've already introduced myself, Loretta Nunez. So what is our challenge? Well, our challenge is to prepare for the future education, and future practice. And what does that future look like? Well, there are many factors that are informing our future. One of the responsibilities of our association and the ASHA Board of Directors is to be mindful stewards of the future of the professions. One way that they are doing that is that the ASHA Board identified an envisioned future for the professions and established 8 strategic objectives essential to achieving that vision by 2025. You can review ASHA's Envision Future 2025 document on the ASHA website. Go to www.asha.org and search Envision Future 2025. Interprofessional education and collaborative practice is a part of the Envision Future for our professions and one of the association's 8 strategic outcomes is to advance IPE and IPP across settings. ASHA is working to achieve this outcome by concentrating efforts in 4 main areas. That is, by developing resources for members to learn about IPE and IPP and its value to improve services and outcomes. By collaborating with other professionals and organizations, because this initiative is not unique just to ASHA, and it is an interprofessional effort. We are also working to advance this initiative by promoting research in this area and infusing interprofessional competencies into ASHA's policies and credentialing standards, such as the scope of practice for the professions, ASHA's Code of Ethics, and accreditation and certification standards. Our hope today is that you will further your understanding of and commitment to IPE and IPP. To get us started, we'll first talk about what we're going to cover in the next 2 hours. We'll talk about what is interprofessional education and interprofessional practice. Why is it important and why now? How will it impact services and outcomes for individuals and families? What skills are needed to effectively engage in an IP, education, or practice environment? We'll also talk about ways to help you get started or to help you scale up your engagement. And we'll have you identify at least one thing you can do in your work setting to help change the way you work and learn with other professionals. So let's get started. I want to share a short video that illustrates what happens when there is a lack of interprofessional practice in healthcare and education settings. Let's listen to these individuals tell their stories.
Yes, a few years ago I went through a very painful experience in my life. I had severe back pain and neck pain, so I went to see my primary care doctor, which did an X-ray and just told me to exercise and make sure that I stretched. But the pain was so severe that I just couldn't exercise. So I decided to move on to a chiropractor. And the chiropractor would work on my back and neck, and the pain would go away as soon as I left, of course, her office, but then it would come back in no time. So from the chiropractor, I moved on to a neurologist who gave me a prescription and sent me to a physical therapist. And I would be seen by the physical therapist and the chiropractor at the same time, but there was no communication between these two professionals, and at the end I was left with the pain and being twisted back and forth, which did not help my pain at all. I believe it is important for professionals to work together to bring the best treatment for patients. And if the professionals who worked with me had collaborated together, it would have saved money, time, and it would have saved me some sanity as well.
My husband Larry this past fall had heart valve surgery, which involves cracking the sternum, and it's major surgery. And he had to have this done because he had a couple congenital heart defects, and this was preventive surgery. In the lead up to the surgery, when we were talking to the surgeon and his team, we told them also about his fibromyalgia, a condition he's had for years, and how it tends to go out of control when he has other health issues. They took extensive notes and said it wouldn't be a problem. He had the surgery, came out of it fine, but within hours after his surgery, his pain levels were spiking through the roof because the team that was caring for him in the ICU did not pay attention to all of the notes that they had made before he had gone into the surgery. I knew before we even went into the hospital that I was going to have to be Larry's advocate, and I was prepared to do that. Unfortunately, my expectations came totally true when they completely ignored everything that we had told them before the surgery and everything that I was telling them after the surgery. So I had to step forward and really be pushed back a lot at various points to get them to pay attention and for them to create a system by which they would deal with his fibromyalgia while they dealt with his recovery from heart surgery. And basically I had to step them through the process. And unfortunately they let his pain level spike to a point that when they asked me what we normally did, I didn't even have the answers because we never let his pain get that bad before we take action. Interprofessional practices is so important because the body is not a series of standalone systems. It's an integrated system that works together. And when you have one problem, for example, heart issues, all of the other parts of your body are involved as well. And in this case, we saw that with Larry's fibromyalgia.
So I have dysautonomia, which is an umbrella term. So specifically, I have neurally mediated hypotension, which means my blood pressure drops, and postural orthostatic tachycardia syndrome, which means when I stand up, my heart rate goes up. But it's a syndrome, so it affects all parts of your body. So it took me, I probably was born with this, but it took over 40 years to get diagnosed. But once I got diagnosed, treatment became another issue. I have a specific situation where I have a tooth that needed to be worked on. It just needed to have a crown put on. But because I couldn't find a dentist to work on it, it took about 4 years to find a dentist who would work on it. The tooth finally broke, and now the tooth needed to be pulled. So the dentist and my dysautonomia doctor needed to speak to each other because there were certain procedures that needed to be followed. And it took a lot of work on both their part and my part to try to get them to speak to each other. They finally did. The dentist did not follow the exact instructions. So I'm back to square one and going to another dentist trying to do the exact same thing so that I can get this tooth pulled. The value of interprofessional practice is that obviously the doctors would be communicating with each other. So hopefully that would relieve some of the emotional, physical, and financial burdens that have been brought to me and to other dysautonomia patients. At this point, a lot of the communication is done online between patients. It's not done between doctor to doctor or doctor to other kind of medical professional.
My son's diagnosis, it was quite a journey. We realized at age 2 he was really only making one sound. We contacted our local infants and toddlers program and had an evaluation, had a hearing test. Everything was normal, and we started seeing the SLP from the infants and toddlers program once a week. He really wasn't making any progress after a few months, and she suggested that we see some additional specialists. We went to Kennedy Krieger, saw a pediatric neurologist. Everything was normal. Had an MRI at Hopkins. Everything was normal. They suggested that we increase the sessions with an SLP. We added 2 sessions with a private practice SLP. And really, he made some more progress, but the progress still wasn't there. So she suggested that we get some second opinions. And the second opinions, we went through that. Still, everything was normal. And eventually, I realized that my son's still not talking, and something must be wrong. But I'm going to all of these people, and they're telling me everything's normal. And I looked at it and thought, why aren't these people talking? In my experience, I felt there was a lack of communication with all of the different people that we were talking to. I felt like I was the advocate. I felt like it was almost like a Venn diagram, and I was trying to figure out from all of these people what was overlapping, what wasn't overlapping, what was supposed to overlap, what wasn't supposed to overlap, and really trying to figure it all out, figure out who I should be talking to and who should be talking. Eventually, what I did was get a summary from all of the different specialists, and that really helped with putting everything together in one document and sharing it with all of the different people that we were talking to. What they found is that in each report there were these small insignificant details, but when you put them all together, it actually ended up being something that was significant that really helped my son's diagnosis. In order for my son to move forward and really make progress, eventually all of these people did somewhat work together. I didn't get them in a room. That would have been great, but it didn't happen. However, putting the summary together really helped, and then having the SLPs talk to one another on the phone was excellent in really moving forward and figuring out what he needed. It was a much more holistic approach to what we were trying to accomplish. My son is doing much better now. He's talking. He is still not a normal 3-year-old. However, he has made a ton of progress, and I feel like it was a result of finally getting all of these people together and talking.
So do those stories sound familiar to any of you? Have you or someone you know or care about had an experience like this? Have you had a patient or a student with a similar experience? Now I'd like for you to do some sharing and reflection. I have some instructions for you if you're listening to this webinar with someone else or if you're listening to it alone. So listen to the instructions, and then I'll have you pause the webinar. So if you're listening to the webinar with someone else or with a group of people, take 5 minutes each, or longer if you want to, and share your stories with each other. If you're listening to this webinar by yourself, pause the webinar for a few minutes and take some time to think about a time when you were in a situation where there was lack of collaboration among professionals, either treating you or a family member or a friend in a healthcare situation, or perhaps there was a situation in an education setting where there was a lack of coordination and collaboration. And how did that impact you as a parent or a caregiver, or even as someone who might have been providing services to the student in that setting? So you'll want to pause the webinar while you do this exercise. If you pause the webinar, welcome back. I hope you gained some insight into how the lack of collaboration in healthcare and in education settings impact us personally. If you did this exercise in a group setting, it's always interesting to note that most of us have similar experiences. So let's make sure we're all on the same page before we get too deep into this discussion about interprofessional education and interprofessional collaborative practice. Our next presenter is Lemmy McNeely.
So to ensure that we're all on the same page, let's take a few minutes to talk about interprofessional education and interprofessional collaborative practice. That's quite a mouthful, and we're also going to talk about why that's important. So we are going to use acronyms, as we typically do in the professions of audiology and speech-language pathology. So we will use IPE for interprofessional education and IPP for interprofessional practice or interprofessional collaborative practice. The World Health Organization has defined interprofessional education and interprofessional practice. And the definition that the World Health Organization uses for IPE is that 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. So it's really important that we recognize that it's 2 or more professions that are learning about each other's professions, from each other, so we're teaching, and with each other at the same time. The World Health Organization's definition of IPP, interprofessional practice, involves multiple health workers from different professional backgrounds providing comprehensive health services by working with patients, their families, caregivers, and communities to deliver the highest quality of care across settings. And ASHA has adapted the World Health Organization's definition to ensure that we're speaking more broadly and including educational settings, community-based settings, in addition to health settings. So when we talk about interprofessional practice, it's across all of those settings. The 2 concepts of IPP and IPE do go together. And the reason that we learn with IPE is so that we can engage and have the knowledge and skills to participate effectively in collaborative practice. And why do we want to do that? So that we can improve the outcomes of the individuals who are receiving those services. The loop never ends, so you're constantly learning from, with, and about the professionals that are on your team to continuously engage in high-quality collaborative practice. that continuous learning and continuous collaborative practice will result in the individuals receiving improved outcomes. IPE ideally should begin at the pre-professional training level, and there are several universities that are using IPE as a part of their training for speech-language pathology students and audiology students. And that training should continue throughout one's professional career. Most of us in the room have been out of graduate school for many years, and we were not exposed at that level to interprofessional education. So this concept is new for many of us. And for those of you in the audience, some of you may be students who are currently attending programs that are utilizing this approach. Others may be teaching at universities, and you actually have your students engage in interprofessional education so that they are able to effectively work on interprofessional teams clinically. Some of you certainly may be involved in actually delivering services and working collaboratively on teams in schools, in community-based clinics, in healthcare settings. So if you're involved in interprofessional learning or practice, I'm sure that you're experiencing the successes that are realized by engaging in interprofessional collaborative practice, and that you're seeing the individuals that are receiving your services are benefiting by having improved functional outcomes. So now that we have an understanding of what IPE is, let's talk about why it's important. Why is IPE and IPP important? Take a look at this funnel and keep this image in your mind as we move forward. I'll be talking about how the IPP team approach is collaborative, how it's transparent and patient-student-centered. So it's patient-centered in a healthcare setting, it's student-centered in an educational setting, and it results in improved outcomes with more attention to the safety and cost efficiencies. It's collaborative because we're all looking at the resources that each of the members of the team bring together to have an impact on the outcomes. It's transparent because everyone's aware of who's doing what, and it's centered around the needs of the individual. So looking at outcomes, looking at safety, and looking at cost are all integrated within the collaborative practice model. So let's segue and talk about our healthcare system, in the United States, and how this influences the shift to IPE and IPP. Deb?
You see on the slide in front of you a representation of the professions with whom you may engage depending on the patient's needs. We know that our current method of healthcare service delivery and payment is not sustainable due to cost, accessibility, as well as safety issues. We've been hearing that for quite some time, and it led to the Affordable Care Act, which envisioned new ways to deliver care at lower cost. A major factor in lowering cost is quality. If healthcare providers can demonstrate that they can achieve good patient outcomes rather than being paid for every time they just see a patient, the emphasis is on quality rather than quantity. Good outcomes may be achieved in less time than it currently takes when providers are receiving a financial reward just to see the patient. Another factor in cost saving is improving safety. That is, if preventable errors like giving the wrong medication or discharging a patient without adequate instructions don't occur, then healthcare facilities don't add costs for additional hospital days that result from these errors. Just think about the people that you see on this slide. In what situations would outcomes be improved by working with one, several, or all of these people? Think about how you would work with these team members. Where does interprofessional practice fit in? If clinicians improve their communication with each other and with the patient, they can achieve better outcomes faster and can reduce errors and improve safety. Remember the stories that you heard at the beginning of this presentation, and think how improved integrated practice could have resulted in better outcomes and less suffering. For these reasons, interprofessional practice and education have been very important to all healthcare providers. Working together in an integrated approach improves services and efficiencies and helps all team members facilitate each other's improved outcomes. This isn't unique to speech pathology and audiology. In fact, it's doctors, nurses, and pharmacists who have been the first to come together and recognize that they need to practice in an integrated fashion rather than in a siloed manner. Not only are they working to combine learning experiences for students in these disciplines, but they are working to offer professional development courses that integrate all of these disciplines. So in fact, ASHA and many other professional groups in rehabilitation are making efforts to join this trend and sit at the table as these other professions. So let's talk about the school setting and why IPE and IPP is important to our current educational models. Again, you see another representation of many of those people with whom you may want to work depending on the student's needs. Please note that the student and family is always at the table. So what's driving IPE and IPP in the school setting? The need for this is driven by the many changes that demand increased accountability. We know that response to intervention or other forms of multi-tiered systems of support works best when professionals with diverse experience and expertise coalesce to develop and provide supports and services to struggling students. State standards, either Common Core state standards or standards specific to your state, are best achieved when all professions integrate their services, communicate, evaluate, and train together to support student success. The new Every Student Success Act, as well as the ongoing IDEA regulation, reinforce this need to collaborate to ensure success for all students. Again, think about working with all of the team members listed. Consider how joint focus, training, and communication would lead to more effective and efficient services and improve those outcomes. Pause a moment and just think about one of your more complex cases. With whom would it be best to work with? Certainly a classroom teacher, perhaps a special educator. Think about even planning the assessment as well as the treatment. Think about who is best to address different aspects of the process. So after hearing all of this, you're probably wondering, how is IPE and IPP different from multidisciplinary or interdisciplinary practice? In fact, we did a focus group a while ago, and everybody at the table said, yes, I engage in interprofessional practice and education. But as we listened to them describe their experiences, what seemed to be missing was the consistent, ongoing communication and integration, and a much more deliberate approach to assessing, treating, and evaluating the nature of their services. If you look at this list and are already participating in a team by another name, you may already be participating in an IPP team, but just not calling it that. You may be planting the seeds and beginning the process of IPE or an IPP, or perhaps haven't engaged to the point that the whole team is fully integrated into this process. Keep in mind that there are distinguishing characteristics of interprofessional teams that you want to make sure to incorporate into your current model. Some of these are highlighted here. So let's talk about the first one. The patient student, family is part of the team. We know that that's critical for their understanding of the process as well as their contributions to evaluating and producing good outcomes. The more comfortable the family is with the team, the more acceptable they may be with all of the work that the team is doing. Shared responsibility and accountability. It's so helpful if all of the team understands the student, patient, or client needs in the same way and works according to their own unique experience and expertise to contribute to a positive outcome, as well as to think about how do we know when we're there? How do we know that we've been effective? And that's the accountability piece. It's not a single person on that team evaluating accountability just in their particular area, but looking overall at the process, ensuring that it is effective. Role clarification is another very important aspect of IPP. Everybody at the table has a unique contribution. So we're not asking that you give up your specific role, but in fact, we find this is a wonderful opportunity to help others understand each other's role. What does a speech pathologist do? What does a special educator do? What does the pharmacist do to participate and contribute to these outcomes? The other very critical issue is that it's non-hierarchical and non-territorial. And sometimes this is the biggest challenge in interprofessional practice. We all want to hold on to our specific areas and protect what we do and how we do it. And that's okay in some respects. But we really need to understand all of us contribute in very important and unique ways. And there really isn't somebody that's most important at the table, but we're all important, including the student, the client, the patient, the family, and all the professionals at the table. Transparency is another very critical issue in IPP. We all need to know what the other person is doing, what the client, patient, student needs are, and how we're all getting there. Certainly, this requires building trust among the team, which is sometimes a very challenging thing to do. But by constantly working together, communicating together, engaging together in whatever way necessary to improve outcomes, that trust builds and transparency results. Continuous, seamless, dynamic communication. All of those are really critical words to consider in a communication process. Continuous. So it's not just catching each other in the lunchroom or in the hallway, outside as we're coming in from the parking lot, although those are certainly important opportunities to communicate. Those shouldn't be the only communication avenues that we use. So that we dedicate times to sit down together or communicate electronically, so again that we maintain that close communication, that transparency about what's going on, and are on the same page for delivering and assessing service. Seamless and dynamic communication. So it's not a one-time communication, but again, it's ongoing. It changes depending on the needs of what's happening with the patient, client, student, and what successes one is achieving. Integrated evaluation, service provision, and professional development. I don't know about your experiences, but in my past experiences, that professional development integration has been somewhat challenging. The speech-language pathologist may meet one day and address the training that is felt to meet their specific clinical needs. The psychologists may meet together. The physicians may meet together. But it really is much more successful if we decide what do we all need to learn and to know about to appropriately serve this individual, and then sit down together to plan and deliver that training. Integrated evaluation is also a critical issue. Although we all are familiar with doing our own thing, so to speak, and using our own assessment instruments, it's important before we sit down to conduct those evaluations that we meet and decide, so what do we need to learn about this client, patient, student. Who's the best person to get this piece of data? And what's the best process for getting that evaluation done? Historically, there has been a lot of duplication of services as we all evaluate in our little silos to determine the needs of the individuals with whom we work. So it, again, improves efficiency, effectiveness, and certainly gives us much better data to use when making decisions about the individual's needs. An overarching characteristic of IPP teams is a concept called interprofessional professionalism. You wonder who made that term. A team with interprofessional professionalism shares core values evidenced by their working together and aspiring to apply principles of altruism, excellence, caring, ethics, respect, communication, and accountability to achieve optimal outcomes. As a member of ASHA, many of these issues certainly are inherent in our ethical responsibilities as well as our professional responsibilities. The key to interprofessional teams is the process of determining who is on the team, is most capable, and has the skill set to address the goals and outcomes, and deciding how to use everyone's unique skills to benefit the team and the individual. So think about the teams that we discussed a few moments ago, and think about those with whom you work, the individuals that you serve. Although you've probably interfaced with all or most of these individuals, have you consistently and constantly communicated, assessed, treated, and trained together? If you haven't, let's begin to think about how do I need to do that? And we'll talk about that a little bit more later on. To give you a visual of IPE and IPEP, let's think about silos. On most farms years ago, there were separate silos for each type of grain, one for the oats, one for the wheat, one for the corn meal, and so forth. As farming transitioned over the years, they found that mixing grains from various silos often result in better products. We're all familiar with those multi-grain breads and crackers. Well, those are the result of the best of all grains mixed together into one blended grain. Here's a photo of silos where different grains can be loaded up, and the grain is mixed at the top to develop a mixture of all of the best grains together to produce the product that you really want. I have long been a cooking enthusiast and think about in terms of preparing that meal. I may have a bowl of all kinds of ingredients sitting in front of me. However, it's choosing the right ingredients and how to mix them together in just the right way, at just the right temperature, that really produces those wonderful things to consume. If we think about interprofessional collaborative practice teams in this same vein, we're taking the best of each professional on the team, mixing their skills, talents, and expertise to come up with the best team possible to work with the individuals. We each still have our own unique skill set, but we use that skill set to blend with other skill sets on the team that results in better outcomes for individuals. Some students, clients, and patients will need more from one team member than another at any given time, and they may not even need exposure and integration of all the professionals. But we do always want to have the right individualized mix so that we do produce the best outcomes. Next, we're going to be talking about competencies for interprofessional collaborative practices. And I'm going to turn this back over to Ellen.
So the work of identifying competencies has already been done for us. A set of team-based competencies was developed in 2011 by the Interprofessional Education Collaborative. This Interprofessional Education Collaborative work group is made up of many different professions, including nurses, physicians, dentists, physician assistants, pharmacists, PTs, and OTs. You'll probably notice that I didn't list SLPs and audiologists. We were not part of the original work group. But after the release of this document, the core competencies document, other professional organizations, including ASHA, indicated their support of the competencies and are listed as IPE supporting organizations. So let's take a look at these competencies that were developed. They actually fall into 4 different areas: values and ethics, roles and responsibilities, interprofessional communication, and teamwork. Now, we don't have time in this webinar to really go into an in-depth discussion about each of the competencies, each of the domains, but I do want to go over each quickly and give you some examples of the competencies in that particular domain so you have a sense of what that domain is about. And then we'll spend some time looking at one of the domains in more detail so you can get a sense of the competencies, at least in that one domain. So we have a handout. This is the one that I wanted you to access before you started the webinar. We have a handout that shows these 4 domains and the competencies from each of the domains that's listed. So if you didn't print that handout at the beginning of the webinar, you might want to pause the webinar now and access it, because we will be doing something with that particular handout and the competencies. Then you'll want to restart the webinar and we'll move on from there. So now that you have your handout about the core competencies, let's take a look at the handout. This handout is laid out a little differently from the slides that you'll see in this webinar. And you'll note that the values and ethics domain is the first column in the competencies, and you'll see the competencies related to that underneath. And then the next column on your handout is the roles and responsibilities domain with the corresponding competencies. And if you flip your handout over, you'll see the interprofessional communication domain, and then you'll see another column for teams and teamwork. We don't have time, like I said, to talk about each and every one of the competencies in all 4 domains, but let's go through each of the domains and just talk about some examples of the competencies in each one to give you a flavor of those. So the first domain on your handout is values and ethics. And I just pulled 2 examples from the competencies there to give you a flavor of those. So one of the competencies there is act with honesty and integrity in relationships with patients or students, families, and other team members. And then another competency as an example from the values and ethics is respect the dignity and privacy of patients while maintaining confidentiality of the delivery of team-based care. And you can read through the rest of those competencies in that domain when you have a chance after this webinar. So let's move on to the roles and responsibilities column. And you'll see there a long list of competencies. For example, one out of that column is communicate one's role and responsibilities clearly to patients, families, and other professionals. And that one, I'd like to give you a personal example of how that can be done in a team. I recently assisted my sister while she was going through some cancer treatment, and I went with her to team meetings, her care team. And the first meeting that we went to talk about her plan of care, there were probably about 12 people in the room, and including myself and her, that would be 14. And I looked around the table, and the people started talking about my sister and about her care. And I turned to my sister, and I said, do you know who these people are around the table? And she said, no, I only know one of them, my oncologist, but I don't know who these other people are. So I interrupted the meeting and just said, you know, I'm Ellen, and I'm my sister's, care partner in this journey. And it'd be really helpful for me to know who's part of her care team, who you all are, and what role that you'll be playing in her care. So they were kind of taken aback, I believe. They weren't used to doing this as a care team. So they did back up, and they introduced themselves, and they told us, who they were and what their profession was and what they would actually be doing in my sister's care. And we did notice as we continued to have meetings with her care team over the course of 9 months that every time we met with them, they would start by telling us their roles and responsibilities in her care. And that was really important to us because actually the members of her team changed over time. She had a new oncologist join her team. She certainly had new nurses that were working in the infusion lab join the team. So she had a couple of new people across, the continuum of her care. And so that was really important to us as family to know who those folks were so that we could better communicate with them and we could understand their role in her care. So that's a really simple thing I think that we forget to do as practitioners, either individually when we're meeting with patients and families or when we're in a team. And I think that's a competency that we can all start to infuse, if we're not doing it already, into our daily work with our patients and our students and our families. So another competency in this roles and responsibilities domain is explain the roles and responsibilities of other care providers and how the team works together to provide care. Now that one sounds like the one we just talked about, but it's slightly different. Another example is I was actually in a healthcare setting myself a few months ago, and was my primary care physician wanted to refer me to a few other care providers. And actually, she was quite good at this. She told me why she wanted to refer me and who those care providers were and how they would all work as a team and how she would communicate with them and they would communicate with her and with me as a team and how we would all work together to determine, what was going on with the test results and what the diagnosis might be and what the treatment might be. So again, it's not only explaining your roles and responsibilities when the whole team is meeting with patients and families and students, but also as single practitioners, we need to make sure that when we're talking about other team members and other care providers or educational providers, that we're explaining to the students or the patient and the family how those folks will be working together as a team and what roles they're going to be playing. So let's move on to the domain on the flip side of your handout, and this is interprofessional communication. And just two examples from this list of competencies we have here. One is choose effective communication tools and techniques, including information services and communication technologies, for facilitating discussions and interactions that enhance team function. And, today, when we have so much available to us with technology, it's not always the most efficient and it's not always possible to get a team together in the same location, in the same room physically. But certainly with the technologies and the tools we have today, we can have very efficient communication going on using those technologies and looping in, most importantly, the patient, the student, the parents, and the caregivers. I was in a situation last year where my mother actually was undergoing some treatment, and we were in a healthcare hospital service delivery system, which I thought did a great job of using collaborative practice and a great job of communicating. And we never really sat down in a room physically with all the treatment team that my mom was working with and that I was working with. There were actually about 18 of them total, large group of people. But their communication tools that they were using were so effective and so efficient. We had video conferencing very often with other of the healthcare providers that were located not particularly in the same city that we were in. All of the the care team were on the same communication system. They all had similar phones and similar tools where they were communicating with each other constantly. And they actually gave me and they gave my mother access to this communication system so that we could look at reports, we could see what the team was talking about with my mother's care, we could ask questions, either to the whole team, or we had actually the emails of every team member. So if we wanted to, we could email or call any of the team members that were treating my mother. So we found it very efficient, and it actually relieved a lot of stress for us as my mother as an individual receiving care, and myself helping my mother. It just relieved a lot of stress to know, that things were transparent, that the team was collaborating, that we weren't responsible for telling each person on the team what happened at the last time we saw someone or the test results we just got. Everybody was looped in. Everybody knew what was happening. And that was just a lot more comfortable for us and took a lot of stress off of the whole process for us. So think about those communication tools and techniques that can be implemented if you're not already implementing some particular tools and techniques, because certainly with the technology today, there are systems out there that will help us and help the individuals receiving care from us and the individuals in education settings that we're working with. Another example of a competency in interprofessional communication is give timely, sensitive, instructive feedback to others about their performance on the team, and respond respectfully as a team member to feedback from others. Now this one, I think sometimes we get so involved in the care for patients or what we're doing with students in education settings. Even as a team, we get so involved that we often forget to stop and evaluate what we're doing as a team, and also what we're doing as individual members of that team. And certainly I think it's quite a challenge to take that next step to give each other feedback as team members. I think it's a matter sometimes of resources, of time, and then also, do we really have the skills, to give colleagues feedback about how we're functioning on a team? So that's a competency, that we can probably all embrace and work on a little bit better and raise our awareness about that being something that's really important to teamwork and collaboration, is giving each other feedback on an ongoing basis. So let's take a look at the last domain, and that one is actually teams and teamwork, and we've been talking a lot about teams and teamwork and the importance of that to collaborative practice. So one of the competencies in this area is engage other health professions or other education setting professionals, appropriate to the specific care situation, certainly, in shared patient-centered problem solving. And then another competency in this domain is reflect on both individual and team performance improvement. And I just mentioned in the previous competency about, we need to spend time looking at how we're doing as a team, not just how our patients and students are doing, but how are we performing as a team, and how can we constantly improve our skills in teamwork? How can we better perform as a team to achieve those outcomes, or help the patient and family achieve those outcomes in healthcare settings and in education settings? So as I mentioned previously, we don't have time to go through all the competencies in each domain, but we do want you to get a feel for one of the domains. So let's look at the roles and responsibility domain on your handout. And there are 9 competencies in that domain. And what I'd like for us to do is I'm going to read the competencies, and certainly you read along with me, in the domain. And as we do that, I would like for you to put a star, or you can circle it, put a star by the competency that you feel is a strength for you. And we'll go through this, and then we'll do something at the end. We'll look back at the ones that you starred and the ones maybe that don't have a star next to them. So you need your handout for this, and you're on the side of your handout that has the competencies for values and ethics, and then on the right-hand side, the roles and responsibilities column. So those are the ones we're going to be looking at. So let's take a look at these. So the first one is communicate one's roles and responsibilities clearly to patients, families, and other professionals. Now, that's the one I just mentioned in a little more detail and gave you some examples. So if that's a strength of yours, if that's something you're already doing and you do it pretty consistently, put a star next to that one. Okay, so the next one on your list is recognize one's limitations in skills, knowledge, and abilities. If that's a strength for you, if you're constantly doing some reflection and self-assessment around your own skills and knowledge and abilities, and kind of have a sense of what you're really good at and what you need to work further on, if that's a skill of yours, put a star next to that. The next one is engage diverse healthcare professionals, or also education-based professionals, who complement your own professional expertise, as well as associated resources, to develop strategies to meet specific patient or student care needs. So again, this one is looking outside your own skill set, looking at the patient or student's needs, and looking at what will complement your expertise and skill set. And who do you need to pull into that team collaborative practice environment? What are some associated resources that you might need? Are there community resources that you might need, school-based resources, healthcare-based resources, not just people, but resources. So if that's a strength of yours, put a star next to that one. Okay, the next one is, and I'm sorry I advanced through the slide, skipped a slide, so hopefully you're with me on this. So the next one is explain the roles and responsibilities of other care providers and how the team works together to provide care. And again, that's one that I used as an example when we were going through the 4 domains, and I pulled out 2 examples from the roles and responsibilities. So if your strength falls in this area, if you're good at explaining, the roles and responsibilities of those other folks in a care setting or in an education setting, and you do that on a pretty consistent basis, and you're, talking with your client, your patient, your families about how all these folks work together and are going to and are providing care or providing services in an education setting, put a star next to that one. So moving on to the next one, use the full scope of knowledge, skills, and abilities of available health and education professionals and healthcare workers and folks in the education setting to provide care and services that are safe, timely, efficient, effective, and equitable. Now that one's got a lot of pieces to it, so you might want to read that one again to yourself. And if that's a skill of yours, put a star next to it. You'll probably notice as I'm reading through these, and you're reading them, you'll notice that I'm putting in a slightly different wording than what's on your competency sheet. And that's because we want to make sure that we are engaging in interprofessional collaborative practice, not only in healthcare settings, but also in the education setting. And as Lemmy said earlier, ASHA has adapted and adopted the World Health Organization's definition, which is geared toward healthcare and health settings, but we also recognize that SLPs and audiologists work in school settings. So we want to make sure that we're addressing and paying attention to interprofessional collaborative practice, not only in healthcare settings, but in the school settings. So that's why you're hearing me change and add in some words into some of these, some slightly different wording. Okay, so let's move on. And the last one on this slide and the next one on your handout is communicate with team members to clarify each member's responsibility in executing components of a treatment plan or public health intervention, or in the education setting, the intervention plan that you have in that education setting. So if that's a strength of yours, put a star next to that. And again, you're probably starting to see, even though we didn't look at every single competency in the other domains, that these cross over a lot. And they all go back to those elements that Deb mentioned earlier about collaboration, transparency, working together, communicating together, sharing. So you'll start to see many of those concepts pop up in all 4 of these domains. Okay, so let's move on to the last ones in this roles and responsibilities area. And let's look at the one, forge independent relationships with other professions to improve care and advance learning, and also to improve the services that you're providing in an education setting. So if that's a strength of yours, put a star next to that. Then the next one is engage in continuous professional and interprofessional development to enhance team performance. If that's a strength for you and for your team, put a star next to that. Now, Loretta or Lemmy, or someone on our group here mentioned earlier in the presentation that we often engage in professional development with individuals from our own profession. Like SLPs will go to conferences or workshops with other SLPs. But this particular competency is looking at how do we learn together as a team of providers. So we do a lot of informal learning with each other, and we do formal learning. We go to workshops and conferences. So think about how your team might do more interprofessional development with each other and team learning, not only to improve your knowledge in content and service delivery areas, but also to improve your knowledge about how teams work together and how to improve your performance as a team of service delivery providers. So the last one on the list is use unique and complementary abilities of all members of the team to optimize patient or student care. Again, if that's a strength of yours, put a star next to that. So look at your list now. You should have, hopefully, some stars on your list because I'm sure many of you have strengths in this competency area. And look at the areas where you may not have a star. You probably have a couple of those. And if you're listening to this webinar with someone else or with a group of people, I have some instructions for you. And if you're listening to this webinar by yourself, I have a slightly different set of instructions for you. So if you're listening to this webinar with a group or with one other person, look at your list and then turn to your neighbor or turn to that person or someone in your group and talk about the challenges that you have with that competency that's not starred. What are some things that keep you from being good in that area or making that a strength in your area? Because we all have challenges with these competencies. So think about that and turn to your neighbor and share that. And also talk about how you might strengthen that competency. And perhaps your neighbor or your colleague that's with you listening to the webinar might have some ideas or suggestions that actually might be a strength for them, whereas it might be something you're trying to strengthen. So share with them. If you're listening to this webinar by yourself, think about the competency, one of the competencies that's a challenge for you, and maybe list a few things that make that particular one a challenge. Write them down, type them on your computer, send yourself an email on your phone, or text yourself. But do something to really reflect on that and write down what makes that particular competency a challenge for you. So no matter whether you're viewing this with someone else, this webinar with someone else, or you're listening to it yourself, you'll want to pause at this point in time in the webinar so that you can reflect on what we just did with 4 domain areas and the one competency area where we went into great detail, and talk about and think about how you might select just one of those competencies to try to strengthen it as you move forward. And when you finish with that exercise, you can take as long as you want to. When you finish with that exercise, you can restart the webinar.
Right. So let's think about how do we move ahead with interprofessional education and practice in your particular workplace, whether that be a hospital, a clinic, your private practice, a university, or a school system. Transitioning our systems to a true IP, IPP environment is quite an undertaking. You're sitting there probably thinking about So who's going to do this? How's it going to happen? It can't be just me. And you're very right. It can't just be you. But like any successful movement, it happens at the grassroots level, one practice setting at a time, one individual at a time, moving forward in a systematic way. If each of us can commit to move this effort along in each of our practice settings, we multiply the results and we see change happen much more quickly. Hopefully, you've been listening to this presentation and you've begun to think about the value of IPP and are considering ways to embrace this practice. What can each of us do? Well, first we can start by asking questions. What will help you to address the needs to get there in your setting? So think about what resources, people, supports do you need in your practice setting to move forward. Think about who do you influence, how do you get buy-in, and who is in your community of practice. It often takes leadership to begin IPP, and we don't always have a so-called leadership title, but can serve in that capacity to begin the process of having others in your sphere of influence to think about this process. Try to get some investment and support in buy-in by others. We certainly know that our administrators need to understand what can this do for them and for the agency or school system or university that they're leading. Why should they engage in IPP? Identify the necessary infrastructure and support systems to make it work. So start by having these kind of conversations around a water cooler, in the hallway, in the lunchrooms. Figure out, how do we initiate these conversations? Who do we engage in these conversations that may also be excited about joining you to move this forward? Start gradually. Don't do it all at once. Start off with who's willing to collaborate and join your team. Take it patient by patient or student by student and approach it this way. Here's a unique situation with an individual. Let's try a joint experience to get people working and talking together. For example, let's say a young child who is on the spectrum of autism comes to the building where you're working in your school. You know a little bit about this individual, but the records seem a little sparse. Here's a wonderful opportunity to engage others in interprofessional practice. First, talk with the administrator. Gee, this is a really complex case we have before us. Who do you think we can get together, and when can we get together, to talk about the needs of this individual? Think about who should be there, and then to begin planning this individual, and start those discussions. Bring everybody around the table, share the information that you already have, and think about, so what other information do we need to gather? And who around the table is best to do that? Perhaps the school psychologist may be able to collect some information about cognitive function. You as an SLP certainly can collect more information about the child's social and emotional communication needs. Perhaps the counselor may be involved in evaluating a little bit more about that emotional issues. The school nurse may have some information about the medications or the medical status of this student, and they can do more to collect more of that. The classroom teacher and the special education teachers can report out on how this child is initially functioning in their settings, where their strengths are academically, and where their needs are. Perhaps as you begin to collect this information, you learn that this child has some pretty significant sensory issues, and not all of you know enough about the sensory needs of children with autism. So you might ask your building administrator to bring somebody in so that you all can train together to learn more about the child's sensory needs. Certainly occupational or the physical therapist need to be around the table and can certainly be a good support in this learning process. And then determine, after you have all the information, the training, and other data, who's going to do what in this child's and student's case. What are the primary goals that are now in that IEP? Think about bringing the family to the table, discuss, now that you've gathered all this information, does it truly reflect that child that they know? Does it reflect their needs? Does it reflect their history? And then talk with them about, here's what each one of us around the table is going to be doing for your child. That you don't need to duplicate services, but you do need to be aware of all the goals that all of you are working on and find ways to reinforce all of the goals necessary for that individual student. Make sure that you have engaged the individual at the top of your organization. Educate those administrators. ASHA website has many resources that you may want to share with them. Talk to them about why interprofessional practice is important and how it really can raise those outcomes and improve efficiency. Think about the IPP components that may already be in place at your work site and find ways to expand those to be more consistent with them and to be more consistent in planning, communicating, and training together. Think about those skills that Ellen just talked about and the other ones that are on the paper in front of you, and try to think about inviting individuals to the table who may complement your areas of strength. We're not all amazing at every one of those skill sets, despite what we would like to think. And so think about who else do we need at the table that can bring strength to our team with other skill sets. Speech-language pathologists and audiologists in almost every practice setting talk about their concerns that other people, colleagues and families, don't really understand what we do as speech-language pathologists and audiologists. I think interprofessional practice provides us with a great opportunity for all professionals to do better in understanding each other's unique roles and responsibilities. So you're almost ready to move forward, and you want to think about other things that you've heard in this program. Identify a competency to develop or enhance, share what you've learned with your colleagues, read other IPE competencies, and again, discuss this with your administrators. Look at your handout and reflect which of those competencies you would like to strengthen in the next 6 to 12 months, and perhaps that your whole team wants to target over this time period. What will you commit to do in your work setting after this conversation? It may be a small first step, like going back to your setting and sharing what you've learned with your colleagues. That certainly is important. Consider, though, interprofessional practice may not be, all aspects of IPE might not be necessary for every individual that you're working with. Avoid that feeling of being overwhelmed and take it one step at a time. Recognize what's working, celebrate those successes, and then consider what can we do next to move further along the street of interprofessional practice. It's hard to ignore a commitment if you make something you say out loud and you share it with somebody else. So if you're listening to this program in a group, why don't you pause right now and identify one action that you'll implement, either as a team or as an individual, that will contribute to a collaborative practice in your work setting. If you're listening as an individual, again, pause this program and write down something that you think you need to do that could move this forward. Consider sending a note to a colleague who may be interested in working with you to start down the IPP path. ASHA does have a website that's dedicated to interprofessional practice. put IPE in the search field on the ASHA website, and you'll find a page that has lots of resources and links to national groups and their resources. And we're continuously adding to this page and to these sites. So come back often and check to see what's new. We also provide technical support here in the office. And so if you have a specific question about interprofessional practice that you'd like to discuss with a member of the ASHA team, contact ASHA by phone or by email with your questions, and we'll be glad to interface with you either through email or phone calls and try to assist you. There are probably a number of things going on in your state at the universities and hospitals, as well as school systems, to find out who's involved in interprofessional practice in your area and get involved in learning from them. It's really important, too, to pursue structures that would support interprofessional practice. So talk with your building or hospital or clinical administrator and think about how can we designate time in our very busy schedules to begin to pursue interprofessional practices. Help them to understand that this small payment of time necessary right now will have some big payoff down the line as you become more efficient, effective, and have stronger patient, student, and client outcomes. So think about other foundational things that you may need to do in your work site to move down the road of interprofessional practice. Now I'm going to close and turn this over to Loretta because she's going to introduce some stories that really show the impact of strong interprofessional collaboration that really made a difference in families' lives and patients' lives.
My son has had a lot of experience working with multiple healthcare providers. He was diagnosed with autism spectrum disorder when he was just past 2 years old. And after that, shortly after that, we started receiving 20 hours a week of early intervention services in our house. At the time, we lived in a small town, and many of these services took place in the morning in our house, and what would happen is there would be a service provider in there working with him, usually starting around 8 o'clock. And as he or she were finishing up, the next one would be in there waiting to work with Calvin, and they would see what the first person was doing, and they'd say, hey, you know, what have we been working on with Calvin? Oh, that sounds great. You know what? I can pull some of that into what I had planned for today. And the whole process just ended up being really, really nice and seamless, and it was probably two of the best years that we could have asked for him at that point. As we moved into the school years, it changes slightly in that the services from all of the providers take place in school. And so it's sort of a leap of faith for a parent that you have to assume that these services are indeed taking place. But what happens is you become more responsible and you become a little bit more aware and you start asking more questions. What I have found, we've had wonderful experiences at school, but what I've found is that what makes a very big difference is when the top people, the administrators, the principals, the assistant principals, everybody is aware of the roles of the team. Everyone knows what a speech-language pathologist does. Everybody knows what an occupational therapist does, and they all know what they're working on with Calvin because that makes it sort of a team effort. My advice to other parents in this situation is to really trust your instincts. You know when your child is making progress, and you know when there's something wrong or something is working, because you live with that child. So my suggestion is to always be on top of it, understand what they're doing with your child, understand the reasons, ask the questions, and don't be afraid to send emails, and don't be afraid to become that parent, because this is important. This is the rest of your child's life.
In the summer of 2008, a local dentist and a local oral surgeon here diagnosed my husband, or noticed something wrong in my husband's jaw. Eventually, they referred us to an oromaxillofacial surgical, very, very specialized team up in Baltimore at the dental school in the University of Maryland. And that team eventually came up with a diagnosis of something called a glandular odontogenic cyst. I'd never heard of that before. Very few people have. It's very rare. The short story is that in order to treat this, it involves a series of surgeries where they remove most of his jaw and replace it with a bone and muscles and arteries from his leg. It was a 2-year process, and for the most part, we were so blessed to have just an amazing team of professionals. The oromaxillofacial surgeons, orthopedic people, all the radiographers, the speech-language pathologists, and somebody called a prosthodontist worked together to reconstruct my husband's jaw and give him back full functioning of his tongue, his ability to swallow, his ability to talk. It was just amazing. There was one, and because they were a team, it was an oromaxillofacial team, and they were very used to working together. Not everybody on the team was located in Baltimore. Our prosthodontist was down in Bethesda, but they all talked to each other. At one point during one of my husband's surgeries, the prosthodontist was Skyped in, so he could help guide the oromaxillofacial surgeon on the placement of some implants and pins and things. It was just amazing, and it was such a comfort to us to know they were working together and talking to each other. So we knew they knew what was going on, and everybody had his best interest at heart. In the end, if you saw my husband today, you might not even notice the scars on his neck. And he's regained full function, and we are so grateful for the team that talked with each other.
Those stories are powerful. Those stories truly speak to the power of interprofessional collaborative practice. Before closing, we would like to address a few common questions often posed about IPE and IPP. I'm going to ask our presenters to respond to these questions. So let's take the first question. As a clinician, should I be doing IPP with every client, student, or patient on my caseload?
Great question, Loretta. No, you shouldn't decide that I'm doing this for everyone, but you should decide based on what the individual needs are that are presented by the families, the patient, the student, and the environment and opportunities and access to other individuals within your community and within that setting. So you may find that everyone on your caseload is someone that you can engage in collaborative practice with. But your goal is to meet the individualized needs of the person that you're working with.
Another thing you might want to consider, you may not need all the aspects of IPE or IPP with every individual with whom you're servicing, but think about aspects of it. Maybe at one point you do need to train together, even on a milder case, because all of you need to learn a certain new skill or a piece of information. That always consider with, from, and about one another, and think about, is there an aspect of one of those that you need to engage with as you're working with a particular client, student, or individual?
I think, too, the situations with patients and students are pretty fluid. Like you might start out, working with a patient or a student by yourself and not need other team members in a particular situation. And then as that situation evolves, you might see, oh, well, I need to bring in other resources. I need to bring in other, someone else, an OT or a PT or whatever the profession is. And even, starting out in a team-based environment, you might see that you evolve into maybe only one practitioner working with that patient or client. So I think you need to be kind of fluid in those situations, and you could go in and out of that interprofessional collaborative practice model in some situations, not everyone, but, I think we need to be open to being fluid in those situations.
And I completely agree with everything that has been said. Whether your caseload is 100% IPP or only a small percent of IPP, as Lemmy had mentioned, it's often going to depend upon the needs of the patient or student or client and their family. And I think that a significant factor to consider is if you're working with a case where there are several other professionals who are providing service to that individual and family, that would be a great example where you really want to think about how can all of us best communicate together and how can we leverage our expertise and the services that we're providing and our thinking in terms of ensuring that we're all communicating and we're coming up with the best plan of care. And as Ellen had mentioned, as your caseload transitions over time, so will your degree of IPP engagement or the need for it.
The other thing I think we need to think about always is engagement of the person you're servicing and or their family. Sometimes we get in a process of reporting out to them without really engaging them in the treatment and assessment process and get their information and get them engaged in all the conversations that you need. And that's not always easy, especially if at times there's an adversarial kind of relationship. But that engagement with the student, if they're old enough and have the competencies to engage, the patient, client, as well as the family, it really enhances the services. It develops that trust that we talked about a little bit earlier, and it really just improves the whole process of treatment.
Okay. So let's move on to another question. Is IPP the only model to consider using? What are your thoughts about this?
No, it's not the only model. There's certainly some significant value in using it, but again, depending upon the needs that are presented and exhibited by the individual and the family that you're working with and the resources that you have access to, the decision needs to be made based on the individual. So there are times, just as Ellen mentioned with the previous question, where one person providing a direct service and working collaboratively with the family may be what's best and what's needed. But that is a dynamic and evolving process. Clinical intervention and services need to be based on what's needed and how you're able to access the resources to provide the needed services.
I think, too, one of the challenges, because this IPP model is still very new to a lot of people, is you may be gung-ho about, let me collaborate and pull these people in for this particular patient or student, but the folks that you're trying to pull into that model may not feel comfortable with it or may not even know what you're trying to achieve with a collaborative kind of, model of care. So you've got a dual thing going where you're going to have to try to educate your colleagues that you want to pull into this model and, get their buy-in and learn to work together as a team. So there are a lot of, like we said earlier in the presentation, there are a lot of challenges to it. It's not just, let's do collaborative practice and assume that everybody knows how to do that and that everybody understands that model.
And I think there are different kinds of collaboration models. I know in the school setting, there are lots of different ways that you can interface perhaps with the classroom teacher, and you all play different roles depending on the model that's most appropriate for the student. I think building success in any model, I know in schools, a lot of our SLP practitioners in schools talk about, well, they're not real comfortable with me coming into the classroom perhaps for the first time. And so how do you work that process best is beginning with somebody that you know and love and that knows and loves you and understands what you do, go into that classroom and show success. There was a situation where an SLP shared with me is she did just that. She went into one classroom. Not only was it a more effective and efficient service, but she really saw great outcomes, not only in communication, but in the student's test score on the state test. Well, the next year, she had people knocking at her door saying, hey, can you come into my classroom? And, so that might be a piece of interprofessional practice that you begin with, is integrating services a little bit better and inviting the OT or the PT to come in with you and join with you. So looking at people that seem to be open to this collaborative effort and looking at different ways of collaborating. Certainly, we've all had training in transdisciplinary practice or multidisciplinary practices, and take aspects of those, and they're very similar to aspects of interprofessional practice, and look at what works best for you in your particular setting.
And I like that idea of modeling it, because we can all sit and listen to a webinar like this and hear the theoretical parts of, oh, here's what the model looks like and here's what we should be doing, but I think a lot of people learn best by seeing it in action. And if we can, as SLPs or audiologists, take the lead and start small with one child or one patient and model that, I think that make the biggest inroads, in this effort.
Okay, and that's all great advice, and I think it's also a good segue to our next question, which is often probably one of the most common questions that we get, and that is, what's the difference between IPP and other team-based approaches, such as interdisciplinary, multidisciplinary, and transdisciplinary? So what are your thoughts about this?
Yeah, I think that really is a great question, because many settings lend themselves more naturally to one of those types of ways in which teams will interface and work collaboratively. Transdisciplinary really looks at having one person be the primary person that interfaces with that patient or the child or the individual and the family, and that the team tends to communicate through that person. And there's a release of the different roles, and the primary person interfacing is usually the person who has the most expertise in the areas where the child or individual has the greatest needs. Multidisciplinary is each person kind of independently assessing and determining what the needs are and then reporting and sharing that at a meeting. And being interdisciplinary means that everyone's involved in that process together and collaboratively, and there's more communication. The added component of interprofessional is that you've learned about each other, with each other, and you learn from each other. So that's a dynamic process that occurs in that continuous loop, as we talked about. And so it's not that it's completely separate from each of those entities, but it's looking at various components. And IPE is to teach us, the reason we get involved in that continuous loop of learning about, from, and with each other is so that we can have a significant impact on the individual's functional outcomes and do it in a collaborative way that's transparent and everyone knows who's doing what. So we're always communicating with each other, including the individual and the family being a part of that process. So there is a difference, but it's not that they are all independent of each other. So I think that one of the great values of, or one great valuable piece of the IPP model is really the about, from, and with, and that it can change and evolve. And so who you're doing that with and who you're communicating with doesn't need to be the same throughout that intervention process.
I think that IPP sometimes also takes all the best of those other systems and brings it together. I also think the thing that's a little different in at least the way we've implemented some of those other practices is that there's an ongoing and consistent communication and planning together. Often we get on a team, so to speak, a multidisciplinary team, and we all share our expertise, but it may be months until we reconvene or recommunicate again. And in some situations that may be appropriate, but I think interprofessional practice shows us that ongoing thought process of who needs to be at the table, how much do we need to talk to one another or communicate with each other, and how do we change what we're doing based on evaluating the outcomes that we're trying to produce. And I think that's kind of the beauty of this system.
Mm-hmm. And I certainly find as well, too, when I think about practice that I've been engaged in over a good number of years, particularly with multidisciplinary or interdisciplinary teams. And I think about settings more recently where I worked before coming to ASHA that came the closest to the IPP. I think about the fact that, there were multiple service providers. We were sharing reports. We were, people had access to records and daily therapy notes. And we certainly didn't hesitate when we had questions or information, like we would reach out to one person and maybe ask them a question if that was the PT about positioning the child or different things that we wanted to think about, or someone may have come and asked about services that were being provided, as an audiologist or a speech-language pathologist. But when I think about IPP, the prime difference is that we are still providing those different services, but we are coming together, as you said, Deb, on a regular, intentional basis to share and discuss that information and to reflect on what we're doing and whether or not we have the priorities right or we have the best plan of care in place. So it does really, for me, come down to communication and collaboration.
And just one other thing, an example I think, Deb, that you had in one of your slides was, not only collaborating in all settings, but collaborating around evaluations, and I think that gets difficult. Loretta, you talked about sharing evaluations, but one of the things I experienced with my mother's care this summer was, how when you see each different professional in a team, they all ask you the same questions, and you repeat your history over and over again when you're seeing each individual professional, and you're, wondering, why can't they all just hear the same thing at the same time? Well, that happened with my mother because that was a collaborative care environment. And the people that needed to hear her history when we first went to this facility, all 6 of them were in the room, and they all asked questions. They all interacted with her. They all were taking down the information, and then nobody had to ask us again for that information. And that wasn't a formal evaluation, but that's a part of all of our intakes when we, start with new patients or clients. So just something small like that, and then everybody was hearing the same thing from us. And they talked about it as a group, and they would have follow-up questions, whereas if they'd been doing that intake individually, they probably wouldn't have had the same follow-up questions because they were all approaching it from a slightly different, different place because they were all different professions.
I think that raises another really good point, that when you do come together on a regular basis, when I've been engaged in those kinds of practices, I learn new stuff that I never even considered had I worked individually and in my little silo. I hadn't thought about, that aspect of a patient or student. The other thing is just that learning about one another. Again, going back to the nobody knows what we do kind of aspect, this is just a wonderful opportunity to have others learn what you do, and your skill set, but as well as the tentacles of where speech pathology and audiology reach into client, patient, student care. So I think those are both really critical aspects.
Okay, and let's see, do we have time maybe for one more question? Okay, so we did talk a lot during the webinar about how to get started. So I'll ask the presenters if they have any final advice or any key points that they want you to be sure to take away in terms of how to get started and what is a good environment to start using an IPP approach.
Well, I think one concern I hear from people is, you guys talk about the ideal situation where you might have an administrator support, you have time to sit down together, you have an environment that is forward-thinking and innovative, and I'm not there in my practice setting. So kind of as we alluded to earlier, think about one place that you can begin and finding the time. Again, we're also concerned about, I don't have time on my schedule to do A, B, or C, but taking time to begin to engage others or just planting the seeds. If you found a great article about interprofessional practice and dropped it in the mailbox of several other people on the team and said, hey, do you want to think about this, or would you be willing to get together to talk about this, might be a first step. Again, working with administrators and talking about what's in it for them. Why is this an important practice? How do you, about improving outcomes, being more efficient, being more effective, reducing costs. Those are all hot buttons for any administrator and might have them sit up and take notice. I was just with a did an observation of a local school here in the Washington, D.C. area that are doing great things in interprofessional practice that started just real small, but even in a school setting, they meet once a week to talk about their most challenging cases. They bring everybody to the table. It might only be a half hour, 45 minutes before their day begins. They don't talk about everybody on the caseload, but they kind of have an agenda of who really needs some conversation and joint planning and kind of start that way. And that seemed like a really good model and a nice starting point for this kind of thing.
Another thought is to have everyone that you think is a potential participant in collaborative practice listen to this webinar and give them the information in advance so that they have an opportunity to prepare for it, and then share information with them. And then after you've had a group of individuals receive this kind of education, identify a patient for whom there are some significant challenges that cross a number of professions within your setting, and then invite individuals to the table to consider this as a possibility as you're meeting and staffing and trying to assess the patient or individual's needs and determine what your treatment plan is. And then you may just identify who those players are that you're going to begin with. And it may not be everyone, and that's okay. I think not setting yourself up for failure, saying it's a failure if I don't get everyone in this building to decide that they're going to embrace interprofessional practice and start where I am. We really should remember that it's two or more. So you can start with just two people and then build. And the example that Deb mentioned with the success, it translates and people then may seek the opportunity to participate in a successful team because of the success of the outcomes of the individuals that receive those services.
Mm-hmm. I just had one other idea. Not only is this webinar available for you to use with your colleagues, but the videos that we used in the webinar are also available separately on our website, and those are short. The first set of videos is like 8 minutes. The last set is about 4 minutes. Those could be good conversation starters. I know when I worked in the public schools and also when I worked in a hospital setting, my principal or the administrator were always putting things out to staff like, who would like to lead a discussion at the teacher, the next teacher's meeting, or who would like to lead a discussion, at the next meeting of our floor at the hospital. And, they're always looking for people to, do like a 15 or 20 minute or a half an hour discussion. And those videos would be a great jumping off point, to play those and then have a discussion with the folks, that are in your group, either there at the school or in your hospital setting or your clinic or wherever you are. So feel free to use those, pull those down from our website and use those for whatever, suits your needs and for discussion groups.
I think that leads to another important point. Although you need some time where you're all face-to-face and talking with one another, you can use that technology to share information on a consistent basis, whether you start a Google group or some other collaboration site, and we all agree that every day or every week we're going to check that site to see what new information is posted there or to post our own questions or concerns or issues. There are ways of improving the efficiency of teams like this by using even something as simple as a chat or an email to share information now and then and engage everybody in thinking about, because we get, you might meet and then you go off and do your thing and you get involved in your own thing and you might forget, oh wait, there's this whole team that we need to continue to collaborate with. And so those ongoing little message points now and then sometimes help to make this work.
Okay. And those are all great ideas. I think the takeaway message from what I've heard everyone say is that it's okay to start small and to grow your engagement in IPE and IPP. And to remember, too, that this is a learning process. It's a learning process for all of us. So you can start with 2 or more individuals and to think about ways that you can take the opportunity to learn about each other's profession, to learn from each other and to learn with each other, and all with the intention of working more towards effective practice and service delivery. Okay. So I think we're just about out of time. So I'll say that in closing, I would like to thank our presenters and all of you who viewed this webinar. We hope you are walking away with the tools to ensure that you may successfully engage in interprofessional collaboration and that you will join us in advancing this important initiative. Thank you again, and goodbye for now from the ASHA National Office.